Are you thinking of working as a nurse practitioner in dermatology field? This episode is for you. I welcome my dear friend Elizabeth Cabrera. She's a family nurse practitioner. She worked at urgent care, emergency room, and now dermatology clinic. And she will share with us her experience of working in different fields, especially in dermatology field. Let's dive in. Thank you so much, Elizabeth, for joining this session. I really appreciate you being here.
Absolutely.
So Elizabeth and I graduated from nurse practitioner program together. We're both family nurse practitioner, and she has a background of working as a nurse practitioner at urgent care and dermatology office. So now she's working in the dermatology field, and let's ask about how it is to work in the dermatology field. So I'm very excited to talk to you.
Yes, absolutely. So I started at the Waianae Comp and I was doing walk-in primary care. And then I left Hawaii, I think around 2016, 2017, and ended up in the emergency room, which was very high stress, but very challenging. And then one of my friends who is in dermatology, she called me and was like, "Hey, would you be interested?" And I was like, "Are you kidding me? That's like my dream job. Let's go." So I interviewed with Dr. Sandy Johnson, who is my collaborating physician. And it has been just an amazing experience. And a lot of people were like, "Oh, you're going to get bored in dermatology. You're just going to look at moles." And it's not. Dermatology is so fast growing. Every day, it's a big learning curve. There's tons of biologics, medicines, aesthetics, and things like that. And for me personally, my panel is made up of medical dermatology, about 75%, and then 25% aesthetic dermatology. So
that's so fun. And I forgot that you worked in ED, the emergency department. Now the memory came back, and you're thinking of like getting certified in the emergency room and stuff like that. So that's a good point that you brought up. That if some people wonder, so I chose to become a family nurse practitioner so I can have more options, but now should I generalize or should I go into specialty? And I think one of the concern is, would I get bored if I just specialize to a certain field? And I get that question sometimes too, like I specialize in women's health, but I totally agree with you that I don't feel bored. There's so many things that you learn and see every day in that specialty. And especially dermatology, you see kids, babies, elderlies, and especially for the aesthetic, there's so many advancements. Even the medical field, I think the psoriasis is fast growing field
it's a
too.
big one.
Yes. Prior to becoming a nurse practitioner, did you have any RN experience, and if so, like in what field did you work in?
Yeah, so I graduated as a registered nurse back in 2006. I went straight into the ICU because I was toggling between ER and ICU, and I did my clinical rotations in both of them. And I think I liked a little bit more holistic approach in the ICU than trying to stabilize the problem in the ER and then getting them to the floor and things like that. And I was an ICU nurse probably about 6 years before I decided to go to NP school. And that was like the best thing that I did. So
wonderful. So some of prospective nurse practitioner students might think, okay, how many years of RN experience should I have? And in what field, what kind of nursing experience will be helpful to become a nurse practitioner? And I think it depends, but from your perspective, what do you think about this?
So I think that's a very hot topic because even like when we were doing our program, we had people that are doing like the MEPN program where they're transitioning and they don't have a nursing degree and they're picking it up as they go. I think it depends on the individual because I don't know if you remember that. She's now a nurse practitioner, but she had a financial degree and she picked up her RN the first year and she was a phenomenal nurse practitioner. I think she went on to do psych mental health. And then right now in our practice, we had a girl who was working just as a medical staff and she picked up her RN and she's phenomenal. And so she literally went right into her RN with no experience, right into a nurse practitioner program. She's doing phenomenal. And then she's going to be one of our injectors that does cosmetic dermatology only.
Amazing.
I think it totally depends on the individual and like how motivated you are and things like that.
I totally agree. I happen to teach a lot of Japanese students from University of Hawaii. And I do feel like when they are a student, I think they should have some kind of medical and possibly RN experience during the program so they can learn how to communicate with the patient and stuff like that. But I don't really think that there's certain years of experience you must have. It would be helpful. And personally, I worked at the PICU as well. So working in ICU and acute care as RNs helped me personally.
But 100% agree.
Yeah, especially you worked at urgent care before, and I bet that the ICU experience and working in an ER really helped a lot, no?
Oh yeah, definitely. Because like you have to switch gears. Like when you work urgent care, you're thinking, okay, what needs to go to the ER that can come back as a liability for you? And then when you work in the ER, you're like, what can I discharge? And your mentality is a little bit different as far as thinking like, what could potentially, if I send this patient home, what could potentially kill this patient? And it's ruling out that most severe disease process or event, and whether you discharge them home or whether you keep them in the hospital. Yeah.
Totally. Wonderful. Elizabeth is amazing nurse practitioner, as you guys can tell. They're very lucky. I think this is off topic, but I think back then we didn't have online. There are some tasks that we had to do online, but I think our classes are mostly in person. And then it was in the evening. So like we worked in the daytime and then we made up after 5 or something. And then our class was until 10 o'clock. And we also had really close relationship with other classmates, and we met up so often. We went on multiple hikes, study session on the weekend. And I think stress of being a nurse practitioner student is pretty hard to share with your family and non-nurse practitioner student friends because it's very unique situation. But having a colleague who really understands what you're going through was really helpful.
100%. I think we had such an amazing cohort of people like you, Ray, myself, Marjorie, Emily, and everybody else who I'm forgetting to name, Allie. I think we had such a close-knit group and we shared each other's experiences. And also, like you said, we did other activities outside of the class to help with stress. And I think that adds like such a huge component to getting through the stressors of nurse practitioner school.
For sure. And I went to the DNP after I graduated, and DNP was mostly online. And although I had some classmates that I called almost every day, so that was really helpful. But I realized the difference of in-person classes and online classes. And I think after the pandemic, a lot of programs switched to online. And I think one of the difficulty might be the connection with your classmates or like even relationship with your professors. Like our professor, one of the professor, we had multiple professors, but one of the professor came to a conference that when we presented, and the support that she being there was, I still remember how grateful I am. So it was so wonderful. Get back to the topic. I'm sorry. It's just like your face. Just bring up so much memories.
I know. I love it. I love it.
Oh my God. It was so hard. It was worth it. Yes. Now you are specialized to dermatology. And how did you get trained for your specialty as a nurse practitioner?
2 ways. So I think as a nurse, it's a lot of experience. When you look at other degrees, they have a lot more hours that they are required. I think for our degree, we needed right under or in the upper of 500. And I think we ended up getting 600. But I think a lot of the training, like when I first got out, was a just walk-in clinic. I think I depended a lot on other experienced nurse practitioners and going to them and technically collaborating with them or collaborating with the doctors when I was a brand spanking new nurse practitioner. Now in dermatology, it was completely different. So my collaborating physician, who is Dr. Sandy Johnson, she literally, I did not see a patient for probably 6 months. Okay.
Oh.
And so I was attached to her at the hip for 6 months, or for 3 months, I would say, attached. And then slowly but surely, they added a patient. We went through a dermatology book this thick. And so every week we would check off X, Y, and Z, X, Y, and Z.
Wow.
And we learned about Mohs, which is skin cancer removals, melanoma, your bread and butter of acne, psoriasis, everything dermatological that you could think of, rash, everything. And so this training process almost felt a fellowship, which I had never experienced before. And I would recommend anybody who's like a new nurse practitioner, go do a residency or some type of fellowship. It will be a wealth of knowledge. And that's what Dr. Sandy provided for myself. And it was a phenomenal experience because literally not only was she hand-holding at the beginning, but I gradually saw patients. Like I was seeing one patient an hour for the first, month. And then the second month, one patient every 30 minutes, because she didn't want to rush us. She wanted us to make sure that we knew what we were talking about and that we would have a good patient rapport with that. So that training was just phenomenal. But my boss is a phenomenal lady.
That sounds amazing. And that makes me feel like I want to work at where you work at right now.
But trust me, we have a lot of people that apply or try to, or are you guys hiring? So I'm very fortunate. So
I'm sure that she saw a quality and personality and hardworking attitude that you have, and she thought that it's a good investment to spend time with you and train you. But is that something that you negotiated during the job interview, or you didn't know how it's going to be, and then it just turns out it was amazing?
So when you look at the dermatology, first of all, it's a very small community. Even when you talk about nationwide, everybody knows who's who in dermatology because of the small community. And I think either 12 years ago, she's very progressive in the fact that she likes new things and likes to explore new things. And so we live in a very small little town, population maybe about 85, 90,000. I'm being generous there. But at the time, it's very hard to get dermatologists to move to our area unless you were from this area. And so she was more progressive, and she hired one PA and one nurse practitioner, and she experimented with those two. And so she literally said, no, this is what we're going to do. And when she brought me on board and the other nurse practitioner that we got hired on within 1 year apart, or to do our didactic together, she said, this is what we're going to do. And so that was great that because I told her that was my biggest fear. I was like, Dr. Sandy, during the interview, I was like, I know nothing about dermatology except that rashes, I see them in the ER, I see them in the urgent care, and they look scary. And I don't want you to worry about that. We will train you. And that's part of her culture. And that's why it's so great. And it starts with a great person and a great boss, because you can be a great person. Like you said, you can have great characteristics, hardworking, be smart, and be a kind person. And I can train you all day long. But if you're a smart person and not a good person, or don't have a good side bed manner, fit our culture. And that's how we pick out everybody across the board at our clinic.
And that's so progressive, because one time I attended a dermatology conference that was happening in Kauai, actually. And during the conference, I think this was 7 years ago. And then I already working as a nurse practitioner in women's health field. And in women's health, because OB/GYN physicians are used to working with midwives and stuff like that, so they are openly supportive of nurse practitioners, wives, and stuff like that for many decades. But when I attended the dermatology conference, they have a presentation of how bad nurse practitioners are on the stage. And I was like, oh my God. They said welcoming nurse practitioner, but they're presenting how awful we are. So I was so afraid that everybody's thinking why nurse practitioners here? But when I was talking to actual dermatologists at the table, they're like, oh no, we have nurse practitioners. But I understand how progressive your boss or employer is to openly invest in PA and nurse practitioners, because especially in the field, I personally experienced that it's a little bit different. I know internal medicine might probably have the same issues with the nurse practitioner. Your boss seemed like she was foreseeing the future, and she felt that's the direction that we
100%.
should go to. Especially, I think, when it comes to rural health. The one I comp is in rural. We're talking about the access to healthcare. We are really talking about how can we serve the community better, kind of thing.
100%. And going back to that, like I'm bilingual in Spanish, and I probably would say I'm the only, either maybe there might be somebody else, but we just had Arkansas Derm probably back in April. And there might be one other nurse practitioner who's bilingual in Spanish.
Oh, wow.
But that's something else that she had the foresight of seeing. I want to bring somebody on who's skin of color in dermatology. Because when you look at dermatology, it's a lot of Caucasian people. I think right now, and even in the last 5 years, they're trying to turn the corner as far as like having even clinical studies, having diversity in that clinical trial and clinical everything. So
that's
she's
so
wonderful.
true, because as an Asian, it's always our group is not integrated as well, and we don't know if the data is actually applicable to our ethnicity. So totally feel that. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner, and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. So speaking of, because you work in Arkansas right now, but you used to work in Hawaii, was there any difference? I don't know. Do you guys have full practice authority in the state?
So we just got like a partial. So we do have full practice authority if you want it, but you have to apply for it. And you have to have, I think, 2,000 hours with X amount of years. And so it's a lot of hoops to jump through. Hawaii was great because like you're out of the gate, but it's scary as a new nurse practitioner because you're like, oh my gosh, like I don't have to consult with a doctor. And so that was a little intimidating at first, but moving from a full practice state where I could write everything and do everything and not have any problems to a collaborating physician state where it was tricky getting my license because I couldn't get a license until I had a collaborating physician, which means that I would have had to have a job first.
So which comes first?
Yeah, exactly. And so literally it was like, okay, I found a job. Now I can finish getting my Arkansas license, which was a nuisance, but in the long run, it's fine. And I think like in specialties, you're in women's health and I'm in dermatology or even like gastroenterology, any of the specialties, I think it's so important to have somebody that, not necessarily that you legally have to have a collaborating physician, but I think you have to have a good relationship and good rapport with that person. So that way, if you do get a complicated patient, that you can go and say, hey, I need help. What can we brainstorm about this patient and things like that? So
for sure. And in Hawaii, we, like you said, we have full practice authority, but that doesn't mean that you cannot consult with physicians. It's
100%.
just that, you can practice independently, or you can have colleagues that you work with. So it's nice to have the freedom. For my second job, which I work part-time at the private practice, I do GYN care, and I don't have official collaborating physicians for that practice, but I cultivated a network of physicians and specialists throughout the year, and they know my personality and they want to help the community. So if anything, then they're happy to help me. So really, it's like you said, I think that's very important, because the most important thing is we provide safe care to our patients as a community. So wonderful. Was it difficult to transfer your license and certificate? I think it's the same, family nurse practitioner.
So I always kept my RN from Arkansas because I think somewhere along the line, somebody had told me, you always want to keep your original state registered nurse. And so I had always kept mine up, even though I had a Hawaii RN and APRN. And so when I came back, it wasn't really hard because that RN was already there and I could but again, it was finding that job to find that collaborating physician so they could give me that license.
So because you also have wonderful experience, solid experience of nurse practitioner in Hawaii, I think it was much more easier to find a job in Arkansas rather than you just graduate from nurse practitioner program in Hawaii and then without experience just move to Arkansas and then you don't have any experience. Wonderful. So you have your own patient panel and then you see patients independently for the most part.
100%, yeah. So my boss is kind enough that she says you can see as many patients as you want, but she does have a minimum. So I, on average, see 4 to 5 patients an hour, and my panel consists. My panel consists acne patients, spot checks for skin cancers, full body exams, and things like that. And we just opened a satellite clinic about 30 minutes from our other practice in another city. And yes, she trained me to the point because that was her goal, is for me to be autonomous, whether she's in the building or not in the building. And so I go to a little satellite clinic that we have in Alma, and I will see anybody that walks in that door for any type of skin condition. And then if I can't, then I usually take pictures and I tell my patient, hey, let me collaborate with somebody on Wednesday and I'll get back to you. And then anything that I think is medical emergency goes to the ER.
See a minimum of 4 to 5 patients per hour. That means pretty much a little bit over 10 minutes each patient. And that includes admin time that you have to you do charting along the way, or you just do the charting in the end of the day?
So we have people who chart for us, not scribes. So we still we have electronic records, but we still have a paper chart. And so I will put my notes and everything on the paper chart, and then somebody will transcribe that to an electronic medical record. As far as admin time, I'm still responsible for any lab that I order or in about skin cancer, melanoma, or rashes and things that they need to do. So I probably would say it depends. Some days I don't have anything to do admin, and then other days I'm like, oh, I've got a lot to do. So it does fluctuate from a day to day depending on what's in my inbox. And then my staff is really good about telling me throughout the day, hey, this person called, they want this. What do you want to do? That's nice in that respect.
Not surprised that you have a staff who can finish a charting for you, because 10 minutes is so short. I experienced that schedule before. But you also, as a nurse, we want to spend time with each patient. We don't want to be like, okay, next, show me your skin. Okay, this is diagnosis, serious prescription, get out of the way, kind of thing. I think that's the only way. And then if you see 4 to 5 patients minimum per hour, oh my goodness, that's a lot.
It is, but it's doable, I promise. So some of the girls that like the PA and the NP that have been there for a long time, one of them was doing kind of half and half cosmetic and medical dermatology. And so one of them sees about 6 to 7 an hour. And then the other one was seeing about 6 to 7 an hour as well, too. So that's why we have a lot of like wiggle room in there. Eventually, that's where I've been in dermatology now since 2020. And just this year, I was like, oh, I think I want to see 5 an hour now. Before I was seeing 4 an hour. And so there is that room to increase your patient capacity and things like that.
Do you prefer medical or aesthetic, or you enjoy both?
I think I really enjoy both. And I think it keeps me on my toes. I really like the cosmetic point of view because, you're making, like, when people come in and they're like, oh, I don't like this about me, and you can make them feel better about it. And even in medical dermatology, I was going to say my Dr. Sandy Johnson, she just gave a PowerPoint presentation at Arkansas Derm where every dermatologist is a cosmetic dermatologist, because you should be talking to every single patient about sunscreen in the morning and a retinol at bedtime, because retinols do lots of things. So yeah, but I do enjoy the mix that I have.
That's amazing. Is there any advice that you will give for nurses who are thinking of becoming a nurse practitioner? Any advice for them?
Yes. So like I was saying earlier, if you have a chance to get into a fellowship program, do it. It would be the best thing. I had the opportunity to do it and I didn't do it. And not that I regret it because everything happens for a reason, but I think it puts you a lot ahead as far as like the learning curve, because there's only so much that they teach you in school. And that residency is going to teach you more renal, all of the systems and things that you should be looking for as well too. There's new medications that we didn't even learn in school and things like that. So definitely that. The other thing that I struggled as a nurse practitioner is setting boundaries for yourself. And I think being able to set boundaries for yourself, take your 30-minute lunch break. Don't eat and chart. Go outside on a bench or take those 30 minutes to decompress and de-stress. Leave your work at work. Unless you need to take it home, then bring it home. But set those boundaries for yourself. Work maybe you go in 30 minutes or an hour early, work while you're there. And same thing, like maybe I'm going to stay an extra hour for administrative things like that. But I think like for myself as a new nurse practitioner, I was waking up, charting, going to work, seeing lots of patients, getting behind on charts, taking my work home until 10, 11 o'clock. And it's a vicious cycle and it can be very like detrimental to your mental health. So that's why I say take your time that you need, find physical activities, whether that's walking on the beach or something that is your happy joy to help you with that stress and things like that. So
I think first 6 months was really the hardest for me. That I remember I did the same thing too. I was working on the chart in the morning before clinic starts. And then also I was prepping for the day. Okay, this patient's gonna come here for this. Okay, I don't know about this, so let me just take a look. But for you, it's harder because working the walk-in, you don't know who's going to walk into your clinic.
Exactly.
So,
and I think that goes back to the point that you were trying to make, like during the interview process. Ask to come shadow the clinic for 4 hours, to the work environment that you want to work in. Like, how many patients are you going to be expecting me to see when I like start? What are you going to do for training? Don't forget about your CME and like that.
Yeah. Or like if you have your own designated medical assistant, or every day you work with different assistant, and then nobody really knows how you practice and stuff like that. Really change. You know, it's so important. And I don't remember, I think back then, when we graduated, the residency program for nurse practitioners weren't, I think after we graduated, it became available. But I think right after we graduated, it wasn't available for us immediately. So I pretty much did the same thing. I asked my first employer, I told her that I don't know anything about the field. So I begged her to read all my notes for, I forgot how many months, but she read all my notes for months and months because I really didn't want it to miss anything. It came to the point that she was like, I have nothing to say about your notes. It looks all good, so we're going to stop this. That was the decision making for me, that I didn't really look for a high-paying job. For my first job, I was looking for mentorship, that I wanted to make sure I get support. Yeah, I think if you cannot get into residency program or fellowship program, because those programs are very limited, the other thing you can do is maybe you can ensure that your employer knows where you are in terms of your knowledge and skill, and then make sure that they're willing to be patient and teach you until you feel comfortable.
100%. Good words.
Are you happy that you are nurse practitioner versus staying as RN? What do you think?
100%. I was all like, we are in like the dreamland, especially in dermatology. And I thought what was super funny is like when I first graduated as a nurse practitioner, my first conference that we went to was Maui Derm.
I think it's probably the same. Actually, I think it's the same company.
Yeah, so it's a big one that everybody loves going to, and it was
because they feed us
Ray
so well.
and Marjorie. Yeah, no, they're great, and they give you like tons of. I've gone to conferences where you get like little like swag bags and stuff like that, like amazing little products and stuff like that. But I remember sitting in one of their talks and they were talking about biologics, and I'm like, wow, this is way over my head. And then now here I am, and I'm going to these other conferences and things like that. I'm like, oh, this is really cool. Like now I know what a biologic is, and et cetera, et cetera. But being a nurse practitioner for myself is probably number one, the best personal investment that you can make for yourself. So
you travel often, and I do travel often as well. And I think work-life balance of course, during the program, and then working as a new grad is super hard. But after that, it's totally worth it versus working at a hospital. And of course, we need nurses working in a hospital doing acute care. We really appreciate you. But I think it's our job is more life-giving.
Yes. And I think when you look at it, so what's funny about that statement that you just made. So my cousin, she's a nurse practitioner. She worked at Cal State San Francisco in the she was an acute care nurse practitioner. And we just came back from El Salvador in April, and she was telling me, she's all, my line of work is so stressful. I could technically go back to being a bedside nurse as an RN and make more money as an RN. And I was like, wow, really? Shocker. She's like, I don't want to do that because then it's going to be hard for me to find a job in the future. And she's been doing this probably for the last 5 years and things like that. But, you know, everybody has their own, like, you need to find what works best for you.
I hope you enjoyed this episode. Unfortunately, there was a software failure and the end of the interview was cut off, and also the video was not recorded. So this is going to be like a podcast. But it was so nice to catch up with my dear friend Elizabeth, and I hope you learned something that is helpful from this interview. Please comment if you learned something that is helpful for you or any requests for future episode. Alright, I'll see you in the next episode. Aloha, take care.